guys, welcome to another episode on Schoolonair. I'll be your instructor for today, and today we'll be taking basic technology. And the topic for today is safety. It's going to be a continuation of what we started in the last episode. In the last episode, we talked about safety, first aid box, and materials that can be found in first aid box and their uses. So in today's episode, we'll start with application of simple first aid. First aid can be administered on accident patients and domestic accident patients. We learned in our previous episodes that there are different types of patients. There are different types of accidents. There's the road accident, there's the occupational accident, domestic accident, and so on. So the following are areas that simple first aid can be administered. The first area that we are going to be treating is bleeding. As a result of a break of the blood vessels by wounds, cuts, and injuries, there is usually an outflow of blood, which, if not managed very well, could lead to infection and then to the death of the patient. So when the patient sustains a wound or cut or injury, you will notice that blood starts to come out of the spots where the injury occurs. So this is because some of the blood vessels have been broken, and if this bleeding does not stop, it could lead to the death of the patient or critical condition of the patient. Bleeding could be internal or external. There are three types of bleeding, and they are as follows. One is the arterial bleeding, second is the capillary bleeding, and the third is the venous bleeding. First, arterial bleeding. This normally occurs as a result of damage to the artery due to a cut incurred from an accident. Now, so when a cut is done, or when a patient secures a cut on his skin and blood starts gushing out, because the artery is actually above the vein in the body. So when a cut happens, the artery is cut first. So when this happens, blood starts to come out. The second one is capillary bleeding. The capillaries are situated close to the surface of the skin and may get damaged easily due to slight accidents. This occurs when the blood oozing out of the body comes from a ruptured capillary. It is the type of bleeding common at the site of all wounds. Now, capillary bleeding occurs when there is a scratch or a rupture on the surface of the skin, because the capillaries are the blood vessels that are situated close to the skin. They are the closest to the surface of the skin. So when there is a cut or an injury on the skin that is not so deep and there is bleeding, the kind of bleeding that you see is capillary bleeding. Venous bleeding. This occurs when the blood oozing out of the body comes from a damaged vein. Blood from a damaged vein usually comes out profusely from the body because the vein is situated deep inside the body, deep below the flesh or the skin. So for an injury to be done on the vein or to happen to the vein, that means the injury must be deep. And if this happens, if the vein is being cut, blood will come out profusely from the body because the injury is very deep. Treatment of bleeding. Most bleeding that occurs in workshops and schools are due to cuts, wounds, or injuries incurred while playing, performing an experiment in a laboratory, or working. Now, while playing, a child could fall and injure his or her hand by scratching it on the wall or hitting it on the ground or hitting his or her head on the ground. And while performing an experiment in the laboratory, this could happen if a glass equipment is broken and someone mistakenly falls on it or steps on it. It is very important to immediately stop bleeding in order to help the victim from loss of too much blood and becoming anemic, as this could pose danger to the victim. So when bleeding is not stopped immediately, it will cause the patient to lose too much blood. And when the patient loses too much blood, the patient becomes anemic. Anemic in the sense that the red blood cell counts of the body of the patient would become low because the patient has lost a lot of blood. Cleaning of wounds that occur from small wounds could be done by using cotton wool dipped into methylated spirits and iodine solution on the surface of the wound. Now, when wounds are cleaned, they are cleaned using cotton wool and methylated spirits or iodine solution to clean the surface of the wound. Then, while using the bandage to bind it to prevent the falling off of the wool with drugs applied